Hello dear students, let us talk about keratoconus today, which is a very important topic for everyone. So keratoconus means kera becomes conical. Kera means cornea. So this is a idiopathic progressive ectasia of the cornea in which cornea becomes progressively thin and conical in the center. So friends, when the cornea is not having a constant curvature, the curvature is getting changed after every few days or month, the patients have symptoms of frequent change of prescription, and this prescription is mainly a cylindrical chashma. Okay, so it is an astigmatism associated with or without myopia. So we can have two types of refractive error, astigmatism mainly and myopia. The cause is basically the corneal stromal lamellae. They become thinner. We don't know why, what is the cause. Now, after symptoms, please remember that this is more commonly seen in people who are from 15 to 16, 18 years of age. And it progressive till the late 30s. But afterwards, we don't have keratoconus. So, I can't have keratoconus, right? Now, signs. When such a patient comes to me, the first sign which I see is that when I do keratometry, I see a very irregular curvature. So, I have a suspicion. Now, I would see the rest of the signs. Every word is a question. So, we can have oil droplet reflex in the ophthalmoscope when I do a DDO. I have a scissoring reflex on my retinoscopy. So, these two are very early signs. Next, as the cone progresses, we have Rizuti's sign, the Munson sign, which is very famous picture question, the notching of the lower lid when the patient looks down. We can also have a Fleischer's ring, that is iron accumulation on the base of the cornea epithelium. We can also see vogued striae. These are vertical stress lines on the Descemet's membrane of the cornea. So these are some very important signs. I may also see the corneal nerves which are becoming prominent. Now, how to confirm the diagnosis? So we have various investigations. Like I mentioned about keratometer, it will tell me the irregularity about the curvature. I can also use a Placido disc, that is a bedside test. I'll see not the regular Myers, I'll see distorted Myers of the anterior cornea. But both of them will tell me about only the anterior curvature. What about the thickness? So pachymetry is another useful instrument. It will tell me the thickness of the cornea. But please remember, the diagnostic investigation of choice is pentacam. It will tell me the topography. Topography means everything about the cornea. So I get to know the thickness, the curvature at multiple points on the cornea. So my diagnosis will be confirmed by pentacam. Now the treatment. So first we can give temporary treatment, as in just changing the spectacles every few months, but it is very temporary. So the second is the treatment of choice, that is C3R, corneal collagen cross linkage with riboflavin. So this is the Dresden's maneuver method. So we have to put riboflavin drops, that is vitamin B2, and we have to expose the patient with ultraviolet A light for some duration. So it is said that under ultraviolet A light, riboflavin will act as photosensitizer and it will produce new collagen bonds in the corneal stroma. So the cornea will become thicker, isn't it? Cornea gains strength 300% from the original one. So it is going to halt the progression of keratoconus. That is why this is the treatment of choice. The next, the curvature is still same, isn't it? The cornea is still curved. So we have to get back the curvature. So we have two options. One is intacs, that is intracorneal ring segments, that is a surgical procedure. We put two PMMA rings inside the stroma of the cornea through femtolasers, and the irregularities of the cornea will be corrected. The second one is a rigid gas permeable contact lens. The prototype is rose K lens. So we ask the patient to put rose K lens on daily basis. Okay, so patient has to put a contact lens for few months, maybe few years. So gradually the curvature will settle down. So these two are the methods which we are doing in a stable cone, when the cone is stabilized. But if your cone is not stabilized, first you have to perform a C3R. So friends, every word is a MCQ, every word is a question. Please remember, keratoconus is a very important topic.